Good evening, ladies. I hope you're doing good. I hope your week is going okay. So, let me take you back to school. Today, I want us to know about our normal numbers. Why does this matter? It matters because if you know where you stand, if you know how far away you are from normal, then you can take action and be serious about your health. Before I continue, I just want to give you a few reminders. If you are a woman who is over the ages of 40, I'm saying this because all of us are over the age of 40 in this forum, except for maybe one or two people, and you are not visiting your primary care doctor or any doctor for your yearly physical, and you have health insurance coverage, or even if you don't have health insurance coverage, that should not be an excuse. If you haven't been to the doctor for the past year, then you're not serious about your health. Sometimes we are too ignorant, or we think that we are untouchable as far as our health is concerned. Forgive me, but I know some of us are healthy and we don't need um, to see the doctor, or we feel, or we think, or we are good to go. But you never know. It's good for you to go to the doctor, and it's better for them to tell you, oh, you have 100% clean health record, than waiting until you get sick and then you get told, oh, I'm sorry, whatever you have is too late to fix, or there's no reversing. So if you haven't been to the doctor the past year, then you need to make an effort and be diligent about your health and go see a doctor. So as we discuss about these numbers, I hope you take it seriously. I hope you have a few moments to spare and learn about the normal numbers. That way, when you go to the doctor, you're able to compare and say, hey, the normal is this, my number is this. What do I need to do to fix it? Okay. All right. The first thing we'll talk about here is blood pressure. The normal or the goal blood pressure is 120 over 80 millimeter mercury. And we get really worried if we go above 150. And if that bottom number goes above 90 or even above 100. So why does this matter? It matters because high blood pressure can cause heart issues like heart attacks. It can cause strokes. If your blood pressure is too high, it's not controlled, you can get what is called hemorrhagic stroke, where your veins burst in your brain and it can cause stroke. Okay. Good blood pressure protects your kidneys. You hear about kidney failure because somebody has high blood pressure. So you need to be diligent about this. Protects eyesight because high blood pressures, again, can cause damage to your veins in your eyes or your capillaries or all those blood vessels, and it can cause vision problems. How to improve your blood pressure? Reduce salt intake. If you're taking too much salt to where you're gaining weight or you're getting swelling in your legs, that's not good. We've always talk about regular exercises. So this is why eat fresh fruits, vegetables, and this is really just decreasing the amount of carbs that you take. Just prevents the excess deposits of fats in your blood vessels. And then take medications as prescribed. Sometimes we have a habit of just stopping taking medications because you check your blood pressure and you think that it's normal and that it's fixed, unless you reduce those things that cause plugging in your arteries or veins or whatever. Just taking medication, you may have to continue taking medications unless you resolve those root causes of that high blood pressure. But just stopping medication in itself will not fix it. Your blood pressure will continue to go up, and you may end up with those things that we mentioned up there: heart attack, strokes, and kidney failure, and reduction in your eyesight. Manage stress. If you already have a high blood pressure and you are stressed all the time, your blood pressure will remain elevated, and that is risky. So try to manage stress. Try to talk to somebody if you're stressed all the time, if you're depressed, if you're anxious, or if you're in a situation that induces anxiety. You need to manage that, manage stress, and that will help prevent heart problems. The next one we'll talk about is blood sugars. If you're diabetic, or if you're pre-diabetic, you have goals to, make sure your A1C is the average. This is a test that we use in healthcare. We use to check how your blood sugars have been behaving the last 3 months. It's an average over 3 months. So normal is less than 5.7%. If you're pre-diabetic, 5.7 to 6.4, and then if you have diabetes, your A1C would be greater than 6.5. So your goal really is to stay around the 5.5. This matters because it prevents diabetes complications, and we know those again are kidney problems, vision problems. We have neuropathy, or numbness and tingling in the hands and feet, and slow wound healing, and all those things associated with uncontrolled diabetes. So that's that. So again, you need to try to fix the root cause of the diabetes. Mostly type 2 diabetes is the one that can be fixed by lifestyle changes like losing weight, healthy eating, and all those things. All right, the next one is cholesterol. Three different types of cholesterol. There's low density LDL, which is the bad cholesterol, HDL, which is the good cholesterol, and then there's triglycerides. So your goal is to make sure your LDL is low, HDL is high, triglycerides are less than 150. And when we talk about cholesterol, cholesterol can contribute to cardiovascular problems because again, it causes triglycerides especially, and the LDL can cause arteries and arteries to thicken, and the walls of your blood vessels to thicken, and this increases risk of strokes and heart attacks. So that's why it's very important for you to be cognizant of all your normals and work on decreasing the bad cholesterol if possible. Okay. Again, you can do that by eating healthy, decreasing the amount of fats and carbohydrates, exercising, avoiding smoking, limiting fried foods that can cause elevated cholesterol. The last thing that you want to know about is your weight and waist. This is the one that we've been mentioning a lot. Know your weight, know your body mass index, know your waist circumference, know the normals. You can even Google to know all your normals. That way you can work on decreasing. If let's say you're underweight, if you're less than 18.5, then you know that you need to eat better. If you're overweight, above 30, you're obese above 30, then you need to try to lose weight and work on that. Again, all this will help prevent heart diseases, prevent, diabetes, prevent high blood pressure. All these things can be fixed by lifestyle changes. So I urge you to read about insulin resistance, and because that will really tell you how all these things tie together and how you can work on preventing these diseases through lifestyle changes. So I just wanted us to know our normals. That way, when we are talking about weight loss, diabetes, high blood pressure, then you know what the normals are. If you have any questions, please feel free to reach out to me.